As you know, each Thursday our program is brought to us by Kaiser Permanente, and we're enjoying featuring the various doctors that are practicing locally here in the Orange County area. Joining us today is Dr. Noelani Guaderrama. I hope I got that correct. Doctor, welcome to the program. Good to have you with us.
Thank you.
That first name sounds very Hawaiian.
It is. I was born in Hawaii and then moved here when I was a baby.
Okay. Well, I'm sure you'd like to go back occasionally and visit.
Definitely.
Great place to vacation, as our incoming president can tell you, I guess. Your specialty deals with ladies and specific issues with women.
Yes.
You are a urogynecologist, and you're going to
Correct.
explain that to us. You're actually right over here in Irvine at the Sand Canyon Hospital.
Yes, I work at the Sand Canyon Hospital in Irvine. I'm in the office there, and then also operate at that facility and have inpatients at that hospital.
Okay.
Yes.
And your specific area of expertise is female pelvic medicine and reconstructive surgery. So some rather personal issues that we're going to talk about today on the program. First of all, maybe give us a definition. What is urogynecology?
So urogynecology is a field that specifically takes care of women who have a spectrum of diseases that we call pelvic floor disorders. And that can include conditions like pelvic organ prolapse, urinary incontinence, and also anal incontinence. Pelvic organ prolapse is a condition where in the female pelvis there are different organs that are supported with some supportive connective tissue. And as we get older, that connective tissue gets weaker, and so things start to fall down and the support gets weak.
Is this something that impacts a lot of women?
Yeah, actually there was a recent study that just got reported that up to 30% of women sometime in their lifetime will suffer from at least one pelvic floor disorder. However, it's more common to have more than one, so many women will have a combination of 2 or 3 different types of these problems.
Does childbirth have an effect?
Oh, definitely, yeah. So some contributing factors is just, number one is your genetics, so whatever how strong your tissue is when you're born, and then childbirth, and then age.
Talk about some of the treatment options, and as we find out more today in medicine, a lot more options available to people.
Yes, definitely. So in my opinion, one of the first forms of treatment that I like to do is primarily education, to make sure that the woman understands what exactly is happening and why did this happen and what is it. And then we have some conservative management where we can just do some muscle exercises or support devices that are pretty easy to use. Or we have more invasive surgical procedures that can be done that can be more curative.
What about prevention? Is there anything ladies can be doing before they have to come and see you to maybe strengthen that area?
I think there are definitely pelvic floor muscle exercises that can be done, and certain dietary habits as far as the urinary issues are concerned. There are certain things in your diet that can aggravate bladder symptoms, things like caffeine, nicotine, alcohol, so cutting some of those things out of your daily habits is a good idea as well. Okay,
so some health issues, and that gets back to the educational process as well.
Yes, absolutely.
It sounds like your philosophy is you start with conservative measures like education, asking about how much coffee they consume, if they smoke, if they drink alcohol, maybe how many kids they've had, and then maybe the exercise regime, try that first, and that may be successful.
Definitely. I think, trying to, these conditions, none of them are life-threatening. It's not like we're curing cancer or anything with these. So it's important to say, well, how much are these symptoms affecting your quality of life? And it's very much a quality of life issue. So kind of focus on what can we do conservatively first, and then, but there definitely are the surgical treatments that are available that we could do as well.
Do your Kaiser patients come to you directly, or do they get referred from their primary care physician?
They do get referred, but referrals are very easy. I mean, most of the primary care physicians know that I'm there, and the patient just lets their PCP know that they'd like to come and see me, and they just put in the referral. And I have a group of doctors as well that work with me that do the same thing.
So you're right up the road in Irvine, so people are seeing their primary doctor at Irvine. You're literally on the same, maybe not the same floor, but in the same building.
Yes, exactly.
And you also do your surgical procedures there as well.
Yes, I do inpatient and outpatient surgeries at the new hospital in Irvine.
That's great. That's a brand new facility, so it must be nice to be working there.
Yes.
Brand new.
It's beautiful. The ORs are all state of the art. It's really nice.
I know they were able to design that specifically for the needs of your patients, and so obviously you could help customize that to what you need.
Yes, definitely.
Do the best job in surgery. That's great. We thank you for joining us today. And again, if you folks have any questions about this, if you want to find out more about Kaiser and the good programs they provide, the local number is 932-2052. That's on your screen as well. And you can find out about how you can get involved with the fine medical programs over there at Kaiser and of course that new facility right up the street from us in nearby Irvine. Doctor, thank you for joining us.
Thank you very much.
Hopefully you get
My
a chance
pleasure.
to take a break from some of your work and get back and visit Hawaii periodically.
Thank you.
Good to have you with us. Thanks for joining us on the program today. Again, if you want to find out more about Kaiser, give them a call, 932-2052, and of course they continue to be our major sponsor each Thursday for you right here on Channel 6 News. Our program continues after this brief timeout.
Kaiser Permanente. Thrive